7:15 here at NECN. It has been baby week on the morning show, and there are so many decisions that have to be made before the child is born and then once the child is born. However, an important one that some parents often don't consider needs to be made before the baby arrives. Dr. Grace Santola is the Laboratory and Tissue Bank Director at New England Cord Blood Bank. Thanks for being with us this morning. Let's talk about it.
Pleasure.
Umbilical cord donation or harvesting is a big question that a lot of people don't know much about. Tell us what it is about.
Umbilical cord blood banking is storage of the stem cells that are present in the umbilical cord blood. The umbilical cord, once the baby is born, is cut, and then the blood that drains from the placenta and into the cord contains very valuable stem cells.
So focused on the baby, often you think that stuff just goes away somewhere, but in fact, in recent years, people have begun to harvest it. What's the benefit of harvesting those stem cells for the family themselves? Let's start with that.
First of all, for the family, it allows you to use the stem cells for the baby or someone in the family for treatment of some very life-threatening diseases, cancers, blood cancers. There are over 80 diseases that now can be treated with your own stem cells.
The benefit of stem cells is not completely obvious to everyone simply because it's relatively new. And as a result, insurance companies don't provide you with a lot of support in that regard. How much does it cost to do this harvesting?
The cost ranges anywhere from $1,000 to $3,000 depending on what facility you go with. NECBB currently has an $800 grant that we allow people to use to allay the costs for the banking. But that includes the harvesting, the processing, and the storage for 1 year.
And down the road, you've got the specific stem cells from your body that can benefit you if there's some life-threatening disease down the road that you might face. So it's almost like an insurance policy in a way.
Absolutely.
Is there some benefit that happens where people say, you know what, I can't afford this or I choose not to do it, but I'd like to make a contribution or allow this to be harvested by a bank for the general public? Explain that.
There is public cord blood banking, and they are very selective about what cord bloods they will choose because they need cord bloods that are at very high cell counts. So sometimes you don't qualify to donate yours to a public bank.
When's the best time for a couple to talk about this?
Early in the pregnancy, certainly, but a decision should be made probably in the second trimester because you want to be prepared. You want to have all the information, you want to have your kit, and you want to have it ready to go to the hospital with you.
You do not want to be talking about it when you've got that wonderful little baby in your arms for the first time.
No, absolutely.
Thanks a lot, Dr. Grace. I appreciate it so much.
You're
still
very
have much
welcome.
more to come on Baby Week at 7:30. We're going to tour the first place your new one will be welcomed into the world. And don't forget, you can see all of our Baby Week segments, including the one you just watched, at NECN.com.